Hey guys, it's Dr. Babes, and welcome to another episode of The Good Doctor. In our previous video, we discussed a very important topic, which is your cholesterol, what it is, its types, and what it does in your body. Now, there's a lot of confusion out there. When should you treat it, when not to treat it? Probably because the internet and media have a lot to say about it. Today, we'll be focusing on one of the mainstay treatments of high cholesterol, the statins. So you've probably heard about atorvastatin, simvastatin, or rosuvastatin. These are one of the most commonly prescribed medications for high cholesterol. Statins are used to help better control your cholesterol levels, which can reduce your risk of heart and blood vessel disease, such as heart attacks and strokes. So how does it exactly work? Well, I mentioned in our previous video that cholesterol is made in the liver, right? Then the cholesterol is excreted from there. So it makes sense if you want to stop making cholesterol, you stop the enzyme that makes cholesterol. And that's exactly what statins do. Statins stop the assembly of cholesterol and decrease its output from the liver. So they work primarily by reducing the amount of cholesterol the liver makes.
No.
In addition to that, they have an anti-inflammatory mechanism. So they reduce the number of inflammatory cells inside the fatty plaque. They also stabilize the fibrous cap or that fibrous coating over that plaque, so you're less likely to rupture it. They cause positive change in the muscle cells on the wall of the blood vessel so that it can relax a little bit more easily when your body needs blood flow. So who can take statins? You may have been prescribed statins when your doctor has identified that your blood cholesterol levels are high, also known as hypercholesterolemia. This may be also for patients with a family history of heart disease and with other medical conditions such as diabetes, which is usually associated with high cholesterol. Now, who should not take statins? Statins isn't suitable for all patients. This is a decision that should be made by your doctor. So your doctor should be aware if you may be pregnant or you're currently breastfeeding, as this would potentially harm or result in pregnancy loss. Also, if you have experienced any allergic reactions, or if you have liver disease, or if you're a patient with kidney disease that may require a lower dose. Now, how should you take your statins? Usually, statin is taken once a day with doses ranging from 10 to 80 milligrams, depending on what your doctor says. Many statins work more effectively when they are taken at night because the enzyme which makes the cholesterol is more active at night. Oh no, I forgot to take my statin. What should I do? Don't worry. If you forget to take your daily dose, wait until the following day when your next dose is due. Do not double up your medication. Is there any side effects in taking statins? Well, statins, like any other medications, are not free of side effects. They have the potential to affect different people in different ways. Common side effects experienced by patients include lack of energy, nausea and vomiting, constipation or diarrhea, dizziness, headache, some muscle ache or muscle pains, some liver disturbance, inflammation of the pancreas, or skin reactions. Rare side effects includes allergic reaction, muscle weakness or numbness, pain and swelling of the tendons. Now, if you experience any of these listed side effects, it is best that you consult your doctor. But it's also important to note that most patients taking statins do not experience any side effects. Now, when should you stop taking statins? statins usually take around 4 weeks to cause a noticeable drop in your cholesterol levels. Follow-up blood tests are usually done after 3 months to monitor your cholesterol levels and also your liver function. Most people will continue taking statins for life. This is because they only work for as long as you continue taking them, and beneficial effects will wear off once you stop taking them. But you should immediately stop taking it if you experience serious side effects like severe muscle aching or cramping, which may indicate muscle breakdown, or yellowing of your skin and eyes, which can indicate that the medication is already affecting your liver. Also watch out for severe abdominal pain, as this may be an indication of inflammation of the pancreas, also known as pancreatitis. Now, if you have itchy hive-like rash, facial swelling, or difficulty breathing, this may indicate an allergic reaction. In these circumstances, you must seek urgent medical assistance. Now, I mentioned earlier that together with having your cholesterol checked, your doctor will include liver function tests as well, as this may have an impact to your liver. As I explained, statins do act on your liver, and the most common thing that they can do to your liver is an elevation of your liver function test. These are blood tests that tell us how your liver is functioning. It's called your ALT and your AST, and your doctor often checks them prior to taking a statin. And at some point, the guidelines say that after you have started the statin therapy, you should also check them again. We usually start to worry when the numbers go up above 3 times the upper limit of normal. So normal would be around 10 to 40 or 50 for ALT and AST. And if you're starting to get 150 or so, that's the time we start to worry and we might actually stop the statin therapy, because what it tells us is that there's something about the way that the enzyme that's being inhibited by the statin in the liver is affecting already the liver cells, probably causing the cells to not function or sometimes potentially even burst open and spill the enzyme ALT and AST in the bloodstream. So it's kind of a marker that we use. But often when people have elevations of their liver function test, they are asymptomatic. For them to have symptoms, it usually takes a larger elevation in these levels. Sometimes, people who start in statin therapy get elevations of their liver function test a little bit, but not as more than 3 times. So we keep them in statins, and then they eventually normalize or just remain on elevated levels without any consequences or any kind of clinical sequelae from that. So let's have a short question and answer regarding some myths regarding statins. I want you to put your answers in the comments below to see if you got it right. First one, you can eat whatever you want once you're on statins. Yes or no? If you answered no, you're right. If you're taking a statin, you still need to follow a heart-healthy diet, low in saturated fat, and get regular physical activity. Statins are great. They save lives. But they're not magic. Second, doctors just want to give everyone a statin. Yes or no? Statins work so well for so many people that it sometimes seems like everyone is taking such medication. But research actually shows the opposite. People who actually need them aren't the ones getting them. Are you one of them? Third, statins are expensive. Yes or no? Well, statins can be expensive, but some are much cheaper than others. Generics are cheaper than brand names. And according to Consumer Reports, some drugstores have these medications for as little as $4 a month. Such a great deal, right? To wrap it up, cholesterol is an important and critical contributor to know your cardiovascular risk, so it is important to have it checked and know your numbers and manage it. Not just by asking your doctor to give you statins, but also exercising, eating right, and keeping track on how you're living your life. Thank you for watching. I hope you found this information useful. If you have enjoyed this video, please subscribe, click the bell button, and write down comments below. This has been your good doctor.
To proceed with free online consultation, click the link in the comments section.